on StreamYard. Okay, there we go.
Where you broadcasting from? Let me tag me.
um, I gotta go on my phone. I think it's on my personal page.
Okay.
Yeah, it should be on my personal page. Hey everyone, and welcome back to another episode of Surviving the Shift. I think we're all feeling heavy. I mean, after the Super Bowl and the performance by Kendrick Lamar gave us a lot to think about, especially if you are cognitively aware and was able to figure out all of the Easter eggs that he had in his performance. Then you wouldn't be one of those people running around here talking about, oh, it's so boring.
We hope you'll be entertained.
Exactly.
You
I
know.
wanted to be entertained. I wanted to be, jumping up and dancing and feeling happy. I didn't want a history lesson, but you needed a history lesson because we about to talk about some history and some present and future stuff right now. So, last week we talked about educate. First week we talked about the general gist of what's happening in the government that's going to be affecting nonprofits and social enterprises. And then last week we talked about an industry specific topic, which was education. And there's so much happening in education right now that is going to affect a lot of nonprofits because we happen to know tons of nonprofits that are educational driven nonprofits. But this week we want to talk about the changes that's going to affect healthcare. And there are also a lot of nonprofits out here that deal with mental health, physical, emotional, the full gamut of healthcare, and how the current changes are going to negatively affect, because I haven't seen the positives in it. So I'm just going to talk about the negative. Research, everything is affected. So this is your lane. You take it away.
Girl,
It's not really mine, but
are
you'll take it away.
there any positive? I'm trying to be. I'm trying to be in the middle, right? I was trying for the longest, and I can't. I'm like, okay, let's be rational about this. Let's not panic. Let's not cause an issue. Last week, I think it was when, well, maybe it was the week as soon as the new administration came into the office, there were issues around funding cuts, and almost at the top of this was NIH. Y'all know CDC and all that. Like if you go to the CDC website, or at least when I went last week, there were
It's a mess.
yes, there
It
were
is nothing like it used to be.
nothing surveillance data missing, right? HIV, TB, like these communicable diseases, like the data that was there is not there anymore. Like we don't have. Do we not need to know? Like, is there no longer is surveillance a waste of money according to this administration? I guess it is, right?
Sending out reports is a waste of money. Updating us is a waste of money. So
You're talking about you're talking about a world where diseases run rampant, like at any time. Like we just got out of COVID. We have to be in the know, but we're not going to be because we're disconnected from from the World Health Organization, right? Vital information that we once saw on CDC's website is not there anymore. And now NIH, National Institutes of Health, this is where the research jam comes in. Now, the issue is, or for the administration, that there's too much funding going to indirect costs, right? I'm from a research institution, university. I got my start in research. My first grant was a research and development grant. We were getting traineeships. We're getting paid from research and development grants. What happens now, right? You're talking about 50. Some institutions charge 55%, 55% cost to these NIH type grants, where there's a portion that's going to the actual research, and then there's a portion that's going to overhead to keep these people employed, to pay for utilities, like all this kind of stuff. And the administration says, you know what? Y'all can figure out that stuff right there. We can leave you just a little bit. You can do 15%, and this is what they're trying to bargain with. We can reduce this from 50 to 50, from 50 and 55 to 15. What happens What
You still
happens
have a
if
lot of research.
you don't have a
So
lot?
all the cancer research, the AIDS research, muscular sclerosis, all of these different things that ail our population at an alarming rate doesn't get attention.
And the thing is, when you think about these diseases, and I worked for a while in preventive medicine, right?
Mhm,
And a lot of research dollars went to prevention, to education and prevention.
mhm,
So you're talking about, you have some that are direct research, but you have some that are kind of scattered out over here. Who's most affected by these diseases and these illnesses? These whole people.
mhm,
PO, not POOR, because you can't afford the O and the R, right? Like the people who are most affected by things like HIV, like
mhm,
cancer, like diabetes, like lupus, like all this stuff
mhm.
that research dollars are going to be missing from. Yeah, I think it's the purge. I'm like, oh, it's like, is this? I don't. Again, we're surviving. We're not. I'm not talking about sacrificing ourselves for what's going on.
Right.
Feels like
Mhm,
it feels like it's the purge. Okay, if we get rid of these things, if we keep
mhm.
people out of the know, if we take
Right.
surveillance data away from the public websites, the
Mhm.
Youth Behavior Risk Factor Survey
You're
has
right.
been around for 35 years.
Mhm,
35. I teach on the birth is and the why birth is. And I'm like, okay, you go right there and you look at adolescents' health and you look at mental health and how it affects young people, and you look at smoking behavior and you look at promiscuity, all this kind of stuff that you find in this database
mhm,
that is no longer there. That is no longer there. Now, this administration, I don't even know where to start, but at their priority is to cut funding.
got funding, yeah.
We're going to cut some funding, and we're going to put funding where we think it is best served. But serving,
Whom?
like who are you going to serve with this? Now, if you're taking the funds and you're saying, okay, well, we're going to reinvest, we're going to put it back into research, and maybe this particular cancer research is going nowhere. So
Mhm.
maybe we're going to reallocate it and we're going to put it over here. Okay, well,
Right.
maybe that kind of makes sense. But you're saying National Institutes of Health, we gonna take this money. We
Mhm,
don't we don't care, about whatever you're researching. That's not our problem because we're not scientifically inclined. They're not medical professionals. they're,
no.
they're not, they're not public health professionals. They're just people, with
Mhm.
money who's saying, it makes more sense budget wise to cut it from right there. Why right there? That's purge mentality to me, Tracy. That's it. I mean, that's what.
That's what it says to me as well. Um, but we have to find solutions to combat that. And I think a lot of nonprofit organizations missed the mark when it came to that. So they were
Yeah,
trying to solve problems that already existed instead of trying to prevent those problems from happening, or
yep.
a hybrid of each: prevention and solving the current problems. And I
Mhm,
think this is a great um, opportunity for some of these nonprofits to get into private research,
mhm.
right? And looking to raise money so that they can do it on their own. If the government doesn't want to do it, somebody else
You
has to
gotta
take
do it.
the mantle, because we can't just leave society out here without the necessary information. And I know it sounds like a daunting task, because like you're asking me to raise millions of dollars, um to do what? So it may seem like an overwhelming task for a lot of nonprofits, and they may not have the capacity again to do it on their own.
Mm, it's the capacity piece. I think that for so long, community-based organizations
Hmm.
have shied away from the scientific approach, and
Hmm.
that's what, like, nothing that we do on a community-based organization level is evidence-based enough.
Hmm.
And I think that's one of the problems, because when you're talking about outcomes and you're talking about impact and you're talking about things that you have to measure and you talk about evidence and you're talking about scientific method and you're talking like community-based organizations, like what, like we just want to have a mentorship program, like we
Right.
just want to We're just trying to raise awareness about cancer. We're not involved at that level. And because we're not, this is what is happening.
Right.
So now when it's cut from the federal government and you can't get pass-through funding to raise awareness so that people can get tested, early prevention education for breast cancer and can go and do this thing. Now you're like, oh my God, what do we do? But if we were to come back to, okay, well, we're community-based organizations, but we still have to learn, the inner workings of whatever the issue is that we're addressing. Like we have organizations right now that say, okay, we're here for suicide prevention, but don't understand terminology around suicide prevention. Don't know what suicidal ideation is. Wouldn't know what a Beck Depression scale was if you gave it to them.
Right.
So how are you addressing suicide prevention if you don't understand suicide, right? If you don't understand, how are you addressing cancer? And you're just, okay, well, my cousin died of cancer, so I created this foundation for cancer. But can you go a little bit deeper? Like, do you even understand?
It's usually a surface level thing. And I think it's because people don't know what they don't know, right? And when you tell people how to fill the gaps of what they don't know, it just seems like work.
Yep.
Right? It seems like work. And I know people are going to get tired of hearing me say this, but this is where 1 + 1 + 1 + 1 equals 4. Okay? You have to start merging some of these organizations together.
Yep.
Together, you're going to be stronger. One organization has to have a true scientist on it. One organization needs to have somebody who is very, very fluid when it comes to research and research, writing research papers. I'm not talking about like the ones you wrote in college. I'm talking about real research, right? Scientific research, understanding the terminologies like Ty talked about. Somebody who's a medical personnel. You got to bring, it's not wiping out your nonprofit. It's not taking anything away from you. It's actually going to make your organization stronger. And I know people are probably asking, well, okay, all that's well and good, but the money is still a big factor. If you join together and you can come together with a cumulative plan of how you're going to move forward, how you're going to do things around prevention, how you're going to do things around existing problems, the community will also come together and support your organization. I think everybody's focused on grants, and they're running scared because grants are not available, especially the federal government grants right now. They're not available. But donations should have always been a big factor in your organization, right? It should have had its own line item, right? Donations, individual donations, annual donations, like donations, like 4 line items. Donation is the umbrella, and then what type of donations are you going to be getting should have been singular line items under that. So this is the opportunity to get back to that. And yes, acquiring donations or donors is a skill set that a lot of people don't have, but it's not a hard skill set to learn, right? I mean,
I think for most, founder EDs, they're doing just
all the things,
right? If I'm doing so much, like when do I have time to go out and cultivate donors and do this thing? And it's so much easier to sit at my desk and submit a grant application. That's what people are thinking, right? And I tell people all the time, grants should be in your budget, your hierarchy of funding. If you're going to involve grants, and you don't have to, it should be the very last thing, because you don't have any control over it.
No.
The thing that you don't have control over should be the very last thing. I have control. If I'm going to get done, that's my work. If that person says no, I'm going to go to the next person. I have more control over that.
Yeah.
I don't have control over the president saying we're going to cut this funding, or the foundation saying, you know what, we've changed our funding direction. I don't have control over that. So that's why that should be the very last thing. We've become so dependent on it because it felt easy. And then I feel sorry for a lot of organizations, Tracy, who have even the universities, they've got my alma mater,
Uh-huh.
we're probably the top 2 schools in the country with research dollars.
Uh-huh.
We're a research institution.
Uh-huh.
They're like, "Oh my god," and I'm like, "Yeah, even y'all billion-dollar
Uh-huh.
institutions should have diverse funding
Yep.
portfolio. You around here talking about, oh, NIH pays for everything. Doesn't
Uh-huh.
make sense. And how are you going to continue your
You're
institution
not.
when they're telling you can't charge 50 anymore, you gotta charge 15 and you don't even know how to go and get other monies.
Uh-huh.
What are you gonna do? I mean, with smaller organizations, the dependency definitely shouldn't be as as big, but somebody tricked y'all into doing it. And like we gonna depend,
Yeah.
got on. I talk about the Matt Let's Go guy all the time with the question mark jacket on. It's like, get a grant, get a grant, get a grant. Everybody's like, oh me, I want a grant, whatever, sitting up late at night. I think I should get a grant for this, whatever. And
Mhm.
before you knew it, grants kind of overwhelms your budget.
Mhm.
Now you're sitting here like, what am I supposed to do? Like you said, collective impact, getting with other organizations, tapping into their resources. Now, don't show up
Mhm.
ragged. Don't show up as a bad partner, because that's another
I think
thing.
I had to explain to someone today what that word meant.
Raggedy just ain't no good. Just out of
What
shape.
is it? I always hear Ty say that word. What does that word mean?
Tell them I'm from Alabama. It's just you just not doing well. You
I
just
was like,
you
oh. I
get it
said, it means exactly what it sounds like. And they were like, no, seriously, what does
sounds raggedy, right? It sounds like that's what it is, right? When you're trying to form these relationships with other organizations, you have to also do your part. So if
Mhm.
you're already lazy and raggedy and you don't know what's going on, g- get a little bit together first before you go, because nobody
Right.
wants to pull a whole bunch of people who don't have it going on. So what do you bring to the table to this partnership of yours?
Mhm.
Like Tracy said, well, somebody needs to have a strong scientist or someone with that kind of background. Somebody needs to know how to evaluate. Somebody needs to know how to run successful programs. Somebody needs to know
Mhm.
how to do so. And if you don't have it in your organization, what do you have? Well, maybe I don't have someone who knows how to evaluate, but my program manager is off the chain, so maybe we can get together and
Mhm.
make this work together, because you are stronger together.
Mhm.
And with funds being limited like they're going to be, you
You
know
have to come together as a team.
my camera went off. I don't know
Yeah,
why.
I don't know.
I don't know why my camera went off. Because nobody wants to see me. Hold on.
Technology.
I don't know. Let's see. Let's see. Can you see my chair? Nope. See
Nope,
nothing. I
nothing.
don't know. I don't know why. It says looks like your can. Please, okay. Click the camera button. Okay, y'all, we live. That's what happens when you be live. And stuff.
Yeah.
I don't know where the camera button at. Like, where the camera button, girl? I don't know. Where the camera?
At the bottom.
And to turn it back on. Where?
At the
Oh,
bottom, you go to
oh,
settings.
oh. Hey, y'all.
Yeah.
Oh yeah, that was me. Sorry, so I just messed up the recording. It's good.
That's fine. That's life. Yeah, but coming together to create collaborative impact is definitely going to be a key component to the success of healthcare organizations. So anybody who's in the healthcare industry, whether it be physical health, you're doing stuff like helping people to lose weight, you're helping people to manage their diabetes. Um, Whatever it is, you're going to need to come together with some other organizations. Start looking at other organizations in your community that are in that same industry and figuring out how you guys can come together to be to work and make the community stronger. Now, you have to be of that mindset or temperament where you can play in the sandbox together. You
Mhm.
don't want to go in the sandbox and throw sand in somebody's eye now, you know. So if that's not you, you may not want to be bothered with anything that we're saying here today, okay? Because everybody cannot be the boss. each person's gonna have to take their place in this new combined organization. I am
Mhm.
good at blah, so I'm over that department. I am good at this, so I'm gonna be over that department. And I may be an overall chief where I just manage everybody, and that person will stand in that department. But it's not about it's mine, it's mine, it's mine. It's going to be about, hey, we started this nonprofit not just to get grants, but to actually help the community. And in order for us to stay alive and do that, right, we're going to need to come together and move forward collaboratively. You're also going to need to get a good accountant.
Okay,
You still
definitely.
have to keep your funds separate.
And you said everybody can't be the boss. I think that's the one of the big issues.
Yeah,
Everybody wants to be territorial. Everybody wants to say this is my thing, whatever. We ain't got time for that right now.
no,
We don't have time for that in this where we're in this time that we're living in right now. We ain't got time for that. We got to come together
yeah,
if we want to really make this work. Because the people that we're serving, they still need serving. It doesn't matter
mhm,
if funds are cut. It doesn't matter if they're zero funds. If it shuts down tomorrow, the whole government.
mhm,
The people that we're serving and the people who need what we have or what you guys have, they're still gonna be there. Like
exactly.
somebody
There
still
probably is going to be more of them
yeah.
because there's going to be less places for them to go and get the help that they need. So your traffic is more than likely going
Yeah.
to increase, and so you have to be ready. And I
Yeah.
think that's why Ty and I decided to, because we were just having a casual conversation one day, and we were like, "Listen, this is going to be a big problem." And then we came up with surviving the shift, right? And we're like, "Okay, let's get out here and try to help these nonprofits survive the shift that is coming." Right? So that you can stay afloat. Hopefully, in 4 years, the shift will have passed. We are hoping,
We
okay?
don't know.
But we don't know.
Yeah.
Right now, we don't know nothing
And the
about, except for all of the bad things that are happening. And we don't want it to be doom and gloom. We don't want people to feel hopeless because we're not trying to add to anybody's mental stress. Because I know we're all stressed out right now. I went to the store yesterday and I left most of the things on the grocery shelf.
you're like, look, I'm,
Okay, I was
I'm
just like,
done.
I said, I'm just gonna lose some weight. That's all. Because I'm not buying that for that
I'm
price. There's just no
done.
way I'm buying it.
Mhm.
And there's some things, of course, that you're gonna have to spend money on. You have to spend money on it. But what I went to buy yesterday was optional. And I was just like, you will stay right there. I will not teach you anymore. We're good. Next. And I went to buy whatever else I need. There were several things I left on the shelf yesterday
Yeah.
because now to me that's a luxury product and I don't need it. It's not luxury tasting. It's just something you may like to eat. But so just think about that.
Like, I don't need it to survive. If I don't need it to survive, okay, then we're
We're not
gonna leave
getting
that
it.
on the shelf. And
Right. So there's gonna be a lot more. Like I don't eat eggs, right? You froze time.
I think I'm from my with the same thing with your organization. I keep putting the same things with your organizations though. You have to
Yeah,
look at what you need, like what's the necessary thing,
yeah, exactly.
being able to get through this. And even if we always say if you stay ready, you don't have to get ready. So even if after
Right.
4 years
Mm-hmm.
this wave has passed, you are now equipped, right? Because all
Better
the
equipped.
things that
Better
yeah,
equipped.
the things that we're talking about, they're really things that should have been in place before this administration.
Right.
We've been yelling this for 20 years, right? Like
Mhm,
diversify or die.
mhm,
It had this
mhm,
new flag. We've been
mhm,
we've been
mhm.
yelling this for a long time. You
Yeah.
should never be depending on just one stream of revenue. You should
Mhm,
never go out as an organization by yourself. You should have community partners. You should have
mhm,
if you are going to be strong in the community, you should be visible in the community. There should be some type of coalition or collaborative that you're a
mhm,
part of so that you can get the work done that you're supposed to be doing.
mhm.
This is nothing new. Like the
Right.
directives is nothing new. There
Mhm,
should be some people on that's connected with you in your circle who know more than you. You should have a scientist somewhere around. You should
mhm.
have an accountant somewhere around.
Right,
That's
because you should have had that guest speaker, so you should have a roster already of people who you can now call on to say, "Hey, we need to join forces in a real way to enact real change within our community." right? The surveys still need to be done. We still need to know how many people are dying from breast cancer, how many people are surviving breast cancer, how many people are getting breast cancer, at what age they're getting breast cancer. Still need to know all those factors so that we can prevent other people from falling into the same trap. Okay, so whatever is happening over there in the federal government should not, now I shouldn't say directly, but it should not prevent us from
Mhm.
moving forward as
Mhm.
a community to do what is necessary to protect ourselves and our
Mhm.
future generations.
Mhm. Yeah,
And
this
that's kind of just where it is.
this is time for, nonprofits to rise up.
Mhm.
This is not something that should cripple us as a a nonprofit community. It should be okay. Well, y'all are doing it. We got it. We got this.
Right.
And I think it was you in the first session that we had. You're talking about why nonprofits were
Why
even
nonprofits were created.
created, right? Because there were things that these people couldn't do, or they didn't have the hands to do it. So voila, there you are.
Mhm.
And here, but we've reversed it so much where we're depending on them
On them,
to do it
right?
for us instead
Yeah.
of the way that it was formed to.
Nonprofits were really grassroots community activist organizations, basically. They went out there and they got things done, right? They saw a need and they filled the need. I think right now, and of course, I am not one for poverty in any sense of the word, okay? But I think that right now, too many leaders are just thinking about filling their own pockets and not truly the impact that they're supposed to be having on the community. You can do both. You can live a decent life where you're not needing your nonprofit services or any other nonprofit services, but you also have to make sure that you're taking care of the community that you said you
Mhm.
wanted to serve, taking care of the problem that you said you wanted to solve, right? It's about, remember, I always talk about mission drifting. You cannot be mission drifting all over the place, right? You can't chase the money. That's not what nonprofit is about. It's not about chasing the money, it's about chasing the problem and solving the problem.
Mhm. And
Okay?
stop selling out for every new grant. But like
Mhm.
I don't want. Where's my? I mean, people call Tracy. People call and say, "Okay, can I get a grant? Like, what do you want a grant for? What are they giving me grants for? That's what I want. What's your mission, dog? Like, what is it? What were you formed to do? What problem were you formed to solve? Quit chasing. And this is
Mhm.
why we're struggling.
Yeah.
And like you said, a lot of organizations, especially as of late, people start them to line their own pockets. They start it for their
Mhm.
own and going totally against what nonprofits are supposed to be, because you're
Yeah.
not supposed to start a nonprofit for personal gain. Even though if
Yeah.
you work and you bring in some revenue, yeah, you can draw a salary. That's what you do. You
Mhm.
at work. That's what people do when they at work. They draw salaries.
Exactly.
But folk are doing this because they're saying, okay, I need to get rich first. I need to get my money first. And,
Mhm.
the, and let me go get a grant so I can see if I can get this, if I can bite me a little bit off. Let me do some fun, and forgetting about who we said we were going to serve and who we said we were going to take care of. Right now, where we're talking about marginalized communities, we're talking about folk who, certain administrations, not necessarily have to be this one. This is not, again, this is just what happens when new administration takes place. Now, this is a little bit rough right here. Now, this one, now this one is a little bit, I've been through a couple of them. This one's a little bit rough. But that's to be expected. Some of that is to be expected, where you're thinking, okay, we're here to serve a certain demographic, and that's what I was established for. And the government says this demographic no longer, is what we want to serve. It's your job to say, you know what, we don't care. We're gonna do it anyway. This is what we were formed to do. So why are you so, don't get stressed out because the government says they don't want to support it. You got to find a way to do it. All
Oops,
right.
I'm on mute. Sorry. Yes. So, yeah, I think that is it. So, what's the takeaways from today? One, collaborative
One,
impact.
collaborative. Get you some friends.
Yes.
Get you some, and Tracy, probably COVID. I don't know, because it took a lot of us inside.
Uh-huh.
Probably, stopped us from making friends with people. Like, okay,
Yes. Yes. It did. It really, really did. It did. I think a lot of people don't know how to make friends anymore, and they don't know how to come together
Mhm.
anymore. Yeah, I've seen that.
Mhm. You just
Yeah.
don't know how to start it. Like, okay, well, this
Mhm.
is what I mean, when Tracy and I were first introduced, I'm looking online, right? And I'm like, who this chick? Like, who this like, okay, so like who this chick that doing like this nonprofit stuff and doing it pretty well. And I'm thinking, look, I'm the baddest thing out here in the nonprofit thing. So I'm like, who this other like I don't know who this woman, right? Like real talk. And kind of having the conversation, right? Hey,
Yep.
like
Mhm.
I see you doing the same kind of thing. Like, what's
Yeah,
up
that's
with
literally what you reached out to me and said. You're like, "Hey, who are you? Like, I see you're doing the same thing that I'm doing. Maybe we should
Yeah, maybe
collaborate on
we should work
something."
together, right?
Yeah.
Maybe we should, not that we should fight each other and go,
Yeah.
oh, okay, well, she's not gonna do it and do this, and I'm gonna
Mhm.
do. Look, dude, you know your stuff. How about
Yeah.
we just get together?
Mhm. Mhm.
And that's how you start that, right?
Mhm.
First, figuring out who you need. So we're talking
Yeah.
about creating a collaboration, like who you need. So Tracy mentioned, get some smart people, get some folk who know how to evaluate, get some people
Mhm.
who, if you're in the health type of space, get some folk who
Mhm.
know about it. Because I know a lot of founders don't know. You're
Right.
like, okay, I started this
Mhm.
out of passion because my mom had diabetes, but I don't know anything about diabetes. So now you
Mhm.
need somebody on your team who knows about diabetes because when you go into the room and people are talking about diabetes, you want to know what you're talking about.
Mhm.
Tell me
Mhm.
about your mom. Like, that's
Yeah.
just how it goes, right? So you got collaborative effort, collaboration that you want to have. Point number one.
Mhm.
What's point number two? Stop relying on one source of revenue.
Raw source of revenue. Yes. Yep. Yep. For sure. You can't rely on one source of revenue at all.
Why I
And
review
find
that.
you some experts. I think that's the last part. Find some
Yep.
experts in the different fields, whatever it is that because all of these people are going to be displaced. Think about it. The NIH doesn't have the funds to um, to fund these research projects anymore. What are they gonna go do? Go home and twiddle their thumbs? No, this is time for you to reach out to them and say, hey, come be a part
Mhm.
of our organization and let's put a plan together to raise some money so we can continue to do what you were doing, the research component, but also serve the community. So doing workshops, doing all the different components that already treat the problem that you're trying to research, and you have a core audience. Don't treat them like guinea pigs now, but you have a core audience to kind of get all the information that you're getting. You don't need an outreach person anymore. So that's one job we could cut out because the people are coming to us.
Yeah.
So think about it that way. And I think it will work for you. But yes, so please go on over and join our Surviving the Shift Facebook page, or group. Sorry, it's a Surviving the Shift group that we have, and what we're going to be doing. Do you want to tell them what we're going to be doing?
Yeah, so in a couple of weeks, we're gonna roll out some programs, right, to help you guys survive the shift. So we talked about health, we talked about education. There's like a list of spaces that you guys are in that surviving the shift might look a little bit different. So and if you're depending on what you're doing, your team is going to look a little bit different. But with these programs, we help you to realize who that team is and how to move you forward so that you can actually survive the shift. It's not just, I'm showing up and I'm saying, can you be my friend? Let's do this
No.
work. What's the internal workings of that, and how do
Yeah.
we collectively create this bond, and how do we get funded through the whole thing?
Exactly. That's
So,
a big part. How do we
mhm,
make the money from it?
yeah,
Right?
and the
How do
program
we
that,
get the money to continue to do the work? And of course, pay yourself.
pay
'Cause you're
yourself.
not out here volunteering.
That's what y'all want anyway. Like, how can I get paid? Like, how do we
Yeah.
get paid? How do we get paid to do this work? And so you can stop crying over the federal funding cuts, right? And bring it together. So with the programs that we have, I think the core of it is to really show you how your community can be resourceful in helping you to survive.
Mhm.
That's what you watch the show Survival, right? Survivor. It's
Yeah.
like, okay, so I'm this one person trying to survive, but every once in a while I got to depend on this other person to
Hmm.
do this thing or to help me to do this thing. Like what's the thing? Not Game of Thrones. What's the other thing where you have the Mockingjay? Is that what that is?
Oh,
No,
Mockingbird.
what's the
Mocking.
what's that? I can't even think of the name of the show, of
I
the
watch
movie.
it all the
It had
time.
all parts to it, right?
Yeah.
But when you're out here like that, there's some times where you have to work together to
Hmm.
solve a problem. And the only way we're going to be able to continue to serve our community is if we do that. But you have to know how to do it the right way.
Hmm.
I saw, and I know I kept talking, but I saw, I saw yesterday where we're talking about federal holidays that can no
Hmm.
longer be celebrated or recognized.
Yes.
I saw Veterans Day
Hmm.
on the list,
Care about
and
nobody. They don't care
I'm
about
like, Veterans Day? You have organizations who are serving
nobody.
veterans, right? Y'all, and
Lots
I would
of
think,
organizations. A
yeah,
lot.
I would think that because that is a governmental program that y'all ain't got to worry about funding, but you do,
Yeah.
and how you
It's
serve.
sad. It's
So,
really sad. And these people need help. They need the help. And really and truly, that is one program they should not stop funding.
I'm like, dude,
Yeah.
what is the problem? Like, we can't even recognize the veteran. Like, what is going on? Like, what's happening? But
Yeah.
you got to survive it, right? You want.
Mhm.
We don't want this to be a time where we, hide and cry and spend
Right.
2 years crying. Because if we spend 2 years crying, we're gonna lose. We're
Yes.
gonna, we're gonna
I
lose.
already see some people trying to give up already. I'm like, I don't know about you guys, but that's not for me.
Ain't no give up
I'm not
on
built like that.
gonna
I'm
live
gonna
out
go out fighting.
it's gonna be the best life for the rest of our life, period,
Yeah.
right?
Mhm.
But you have to make it that. So when you start hearing stuff, and I know stuff is, I try to stay away from the news, but I can't.
Yeah. I
But
think everybody at this point is trying to stay away from the news because it's
yeah,
so depressing.
but
But
we
yeah,
really can't because we have to know.
yeah, you
So
have to know what's going on.
when you see things, you just think about like, what's your plan? And
Mhm.
that's what our program does. Like, what's your plan for this? So if they came tomorrow and said, you know what, this little money you got, even if you were at you were getting some funding from a corporation that says we're rolling back DEI, and you have a after school program for Black and Brown kids, and they say, you know what, we can't support this anymore, and they were giving you money every year, you were looking for a continuation, and they're
Mhm.
saying, oh, oops, 2025, we can't continue that.
Mhm.
Most people will cry and, oh my God, what am I going to do? No, I can't do this work anymore. But there are ways that you could still solve the problem. And there's still ways that you could be funded for this thing without that,
Yeah.
which is
You're gone again.
a revenue. Everybody's like coming into your organization so that one thing don't make you okay, well, cool, good. All right, I don't want to do that reporting anyway. I'm going to go over here and do this.
Right. Right. But yeah, that's the gist of the program, right? So we're going to take the different industries, we're going to break it down, we're going to take you through the process so you're not making mistakes because making mistakes can cost you more money than the program would cost you, right? And to take you step by step through the program, showing you how to build the collaboratives, all the paperwork that you need to have in place to make sure you're protecting yourself and the other people are protected from you as well, right? And making sure that we show you how to get to the money, keep the money, take that money, flip that money, and keep that money making money for you. Because I think that's the stage that a lot of people need to get to is to get money and have that money make money for you.
Mhm.
And most nonprofits are not there at this time. And then we don't just leave you, we actually hold your hand for the rest of the year till December. Okay?
Something
So
like that.
we have
For the
regular.
baby, for a whole like a
Yeah.
whole year
Because
in
we
advance,
want to
right?
make sure we're invested in your success. We want to make sure that you're not stressed out. You got to preserve the edges, right? So we don't want your edges to fall out. So we want to make sure that we're with you through the while. We can only take but so many people in the program in that case, right? Because we don't want to be stressed out either. So
Right.
So it's going to be a short number. I think we're still throwing around between what 10 and 20.
10 and 20. No
Yeah,
more than 20.
yeah. Oh,
No
we
more than 20.
cannot do more than 20 people in the program because it's going to be intense, right? Again, this is holding your hand and being like, okay, this is what you need to do. Here's what you need to do. We sit in on some of your meetings, that kind of stuff, and get you through the process so that you are able to keep your nonprofit. Because we know that a lot of you have put your retirement and your
Mhm.
savings and your kids' college funds into these nonprofits. And if the nonprofit goes away, so does all of that. So we're trying to help you to preserve your dollars as well while still impacting the community. So
Okay.
yeah,
That's
surviving the shift. Go like the Facebook page. I mean, join the group. Come on
Facebook
now.
group. Pay the
Yeah.
bill.
Go join the group. All right, bye everyone.